Hi, my name is Dr. Livingstone with Alpine Pediatrics, and we're going to be talking today about anxiety disorders in children. There's a few goals that I'm hoping that we can achieve over the course of this presentation. The first thing that we're going to look at is what anxiety in children looks like. We want to be able to identify that. The second goal that we have is be able to look at some treatment options for individuals or for kids with anxiety. The third thing that we're going to do is we're going to identify some of the skills and tools that you can use at home for kids with anxiety. Now, when we talk about anxiety is it's an overwhelming, abnormal, it's not a normal thing, this sense of fear, apprehension that's marked with usually three components that I want you to keep in mind. There's a biological component or a physiological component with that. There's a cognitive component, or how we think, and then a behavioral component. Usually that's with some type of avoidance. Now, some of the anxiety disorders that we talk about are specific to children. Separation anxiety, for example, is something that we diagnose in children. We don't diagnose that in adults. And then we have other anxiety disorders that look a little bit differently. For example, with kids, you may get a tantrum with anxiety rather than a fear or withdrawal. We can see that too. Some diagnoses of anxiety require fewer symptoms. So for example, in generalized anxiety disorder, we may see fewer symptoms that would be required for a child to have that diagnosis versus an adult. So I want to go through a few different diagnoses and what we see with that. Okay? One of the challenges, and this is an important challenge with anxiety, is that anxiety can be both diagnostic and symptomatic. Now, what do I mean by that? I mean, with diagnostic anxiety, that means that it actually has a specific diagnosis. For example, like generalized anxiety disorder or separation anxiety disorder. You can also have symptomatic symptoms or symptomatic aspects of anxiety. So, for example, you could have an individual that's got some depression, and there are some anxiety symptoms there. There can be significant overlap. You can have a child that's, for example, got autism spectrum disorder, and we may see some anxiety symptoms. That doesn't mean that they necessarily qualify for a diagnosis of a specific anxiety disorder, but certainly something that I want you to consider when looking at both, diagnostic and symptomatic aspects of anxiety. Another aspect with anxiety is it can be both trait-related or state-dependent. What I mean by state-dependent is state-dependent is something that occurs in a specific situation. Let's say you're at the bank and somebody runs in with a gun and yells, "This is a stick-up, give me your money." You're probably going to feel some anxiety. And when you're feeling that anxiety, that's state-related. Some children, for example, might have some test anxiety. That is a state type of anxiety, meaning they feel that anxiety in particular situations. Trait anxiety is more of a characteristic or trait that people have. You'll have some individuals that are just anxious people. And so when we talk about anxiety, I want you to be thinking about those four things. One, could be a diagnosis. Two, could just be symptoms. It could be a trait issue where it's, characteristic of the person, or it could be state dependent. Oftentimes when I'm asking individuals about their anxiety symptoms, those are the kinds of things that I'm looking for, okay? When we talk about specific anxiety disorders, I want you to know about a few of them. Number one, generalized anxiety disorder. Sometimes people think with generalized anxiety disorder that this is just anxiety in general. It's not. One of the classic hallmarks of generalized anxiety disorder is they have an excess amount of worry. And it's worry about normal things. I might ask a parent, "Gosh, do you worry about your kids?" And they might say, "Yeah, I do." Scale of 1 to 10? Maybe 2 or 3. A person with generalized anxiety disorder, that's going to be really high. Well, man, it's probably got a 7 or an 8 or maybe a 10, that they have this significant amount of worry and they have difficulty controlling the worry, okay? Separation anxiety. This is the only childhood anxiety disorder that we use. The essential feature of that is the significant anxiety that comes when they're separated from their primary attachment figure or from home. There's some kiddos that, man, when they leave home or they're away from one of the parents, it's significantly anxiety producing. And so when we talk about separation anxiety, it's often outside of the normal age and stage of development as well. It's not uncommon at all for kids, let's say ages 1 to 18 months, to experience some pretty significant separation anxiety when they're away from their mom or their dad. But that's pretty normal. If I'm dealing with, let's say, an 8-year-old that struggles to be away from mom, or the prospect of being away from mom or dad, or going to school, leaving home, we might be looking at separation anxiety disorder there. Another anxiety disorder is PTSD, or acute stress disorder. PTSD and acute stress are actually very similar. The difference between PTSD and acute stress is the amount of time from the traumatic event that happens. When we talk about post-traumatic stress or acute stress, we're talking about exposure to actual threatened death, serious injury, sexual violence. Sometimes people will confuse a stressful event with a traumatic event. Certainly, traumatic events can be stressful, but not every stressful event is traumatic. You're looking at 3 components with PTSD and acute stress disorder that as a psychologist, I'm looking at to determine if a person has PTSD or acute stress. Number 1 is arousal, meaning they're having a physiological response. These are individuals that are pretty jumpy. They're looking around, making sure that everything's okay. They're easily startled. That's what I mean by arousal. Re-experiencing, those are things like flashbacks. Sometimes for kids, those can be bad dreams. Those can be scary things that happen, feeling like something is happening again to them. And then the third aspect of that is we find that there's an avoidance component to it. They're trying to stay away from the situation. I've worked with individuals, for example, that were in significant car accidents where a person was seriously injured or died, and all of a sudden they feel like the car accident's happening again, or every time they get in the car they're really nervous and they're jittery, or they just avoid being in the car altogether. And so when we look at PTSD or acute stress, that's what we're looking at. Acute stress is usually any symptoms that happen from the traumatic event up to about 30 days. PTSD, 30 days and after. Same symptoms, it's just a time frame with that. Panic disorder. Panic disorder is when an individual experiences an unexpected panic attack. Now, panic attacks are a little bit different from an anxiety attack. Some people can have anxiety where they're experiencing a lot of symptoms and it makes them nervous. Panic attacks, man, this is when a person full on has panic symptoms. In adults, it's interesting because for many men, a panic attack will feel like they're having a heart attack. For women, they often feel like they're going crazy or they're going out of their mind. And what's interesting about panic attacks is not just the presence of the panic disorder, with panic disorder and about panic attacks. With panic disorder, usually you've had a panic attack and now we have a significant fear of having other panic attacks, which can come right out of the blue. That's one of the hardest things about panic disorder is a person could be walking down the street, everything's going fine, and all of a sudden they start having these panic symptoms, significant physiological response. And so with panic disorder, we've had a panic attack and then we have these fear of future panic attacks and we start changing our behavior. Maybe we don't exercise anymore because when I have exercise, it gets my heart going and then I feel like these panic symptoms are coming back. So we change our behavior, okay? Social anxiety disorder, that actually used to be called social phobia. The biggest issue that we see with social anxiety disorder is individuals that feel like they're being judged. They feel like they're being looked at, everybody's watching them, judging them, and they have a significant fear about making a mistake. They don't want to make a mistake. They don't want to do anything that's embarrassing. So for these kiddos, for example, getting up in class and giving a class presentation is just mortifying because, man, everybody's looking at me. I don't want to do anything embarrassing. So a lot of really self-conscious issues there. Specific phobias are another type of anxiety. When we talk about specific phobias, there's actually 4 kinds that I like people to know about. One is animal type. Animal type is where, snakes, spiders, dogs, we have some fear of some kind of animal. Natural type of phobia isn't just that's natural, that's normal. It means it's related to nature. So for these individuals, storms can be a big one. Tornadoes or earthquakes or natural disasters, they have a lot of worry and phobia about that, okay? A third one is blood injection type. Now, I work at a pediatric clinic, and so we see a lot of these kiddos a lot. They have to come in and get their shots, and all of a sudden they are just screaming and are terrified. Those are individuals with a specific phobia specific to blood and injection type. And then we have situational phobias. Those are individuals, for example, claustrophobia or fear of heights. We have, concerns about enclosed spaces, being in, an elevator. So that's your situational type of phobia. And then one that's not actually considered an anxiety disorder anymore. It used to, but still has a significant anxiety component to it, is obsessive compulsive disorder, or OCD. A lot of people sometimes wonder, well, OCD, is it they want things a specific way, or maybe they engage in peculiar behavior. When we talk about OCD, first thing that we look at is our obsessions. An obsession doesn't mean we are really interested in something. An obsession is actually an unwanted, intrusive thought. So we've got a thought that keeps coming into our mind. We don't like it. We want it to go away. And then a compulsion is any behavior that's actually designed to neutralize the thought. It's not so much to fix the situation, it's to make the thought go away. So for example, if I'm working with an individual that has OCD, and maybe the obsession is around germs, or for many individuals, it's contamination. What will happen is they'll have these unwanted thoughts about being contaminated, and they don't want to be contaminated. And so what do they do to make the thought go away? They wash their hands. And so the compulsion is actually designed to make the obsession, make the thought go away. So I want you to know a little bit about those anxiety disorders and what they look at. Now, when we talk about treatment options, there's a couple of different treatment options that I want you to talk about, or that I want to talk about with you. Treatment option number one, medication. Medications have been found to be an effective way to treat anxiety in children and youth. Specifically, the types of medications that we use for treating anxiety are your SSRIs. What's an SSRI? It's a selective serotonin reuptake inhibitor. Specifically, serotonin is a neurotransmitter, and it's released when nerves fire, and then it's reabsorbed by what we call presynaptic neuron, or the cell that's sending it out. And so reuptake is that process of reabsorbing. Well, what an SSRI does is it just makes more serotonin available. It doesn't produce more in the body, it just makes it more available. By making that serotonin more available, we find that's successful in treating the anxiety. Interestingly, most of your SSRIs are actually prescribed by your pediatricians and general practitioners. Some research a few years ago found that most of your psych meds, most of your SSRIs, probably 70% of them, are actually prescribed by your family doctors and pediatricians. Most pediatricians and family doctors are pretty comfortable prescribing that. Now, if working with that and that's not going so well, then they might refer over to someone like Dr. Swenson, who's a psychiatrist. Psychiatrists are medical doctors who specifically focus on psychiatric medications. And they certainly have a lot of training in that area. And so many times what they'll do is they'll say, gosh, if an SSRI is not working, we could try a couple of options, but we may refer you over to a psychiatrist to look at that. Sometimes, again, other medications can be used, but when that's the case, we would just refer over to a psychiatrist. So I certainly want you to know that medication is an option there. Another option that we look at is psychotherapy. Now, I am a clinical psychologist, meaning I spend most of my time doing psychotherapy, okay? The primary form of psychotherapy that I use is what's called cognitive behavioral therapy, or CBT. We talk about CBT, we're specifically talking about cognitive, our thoughts, behavioral interventions, that's the B part, and then physiological interventions as well. As we talked about at the beginning, many times with anxiety, we're dealing with cognitive aspect, behavioral aspect, physiological aspect. And so treatment tends to revolve around those three things. So I want to talk a little bit about, if we can, a couple of skills that you can use with kids at home, especially if they're dealing with some anxiety. The first one that I want to talk about is that cognitive side, or how we're thinking. A lot of cognitive therapy refers to understanding the feared stimulus, or what the scary thing is that we're addressing, and then being able to reinterpret that. Many times I'll tell my little patients that there's stuff that happens to us or things that happen, and then there's what happens in our brain or what we think happens. And so one of the main things that I will do with kids that I'm working with is I'll say, well, let's talk about this thought process. What's the thought that's going on? We then look for the inaccuracy in the thinking and specifically help them to find the inaccuracy of the thinking. Lots of times parents or a psychologist can say, oh, that thinking, that's not right. I can see the error in there. But really, what really helps them is for them to recognize the inaccuracy and them to be able to challenge and replace the inaccurate thought with a more accurate, healthy thought. Let me give you a couple of examples of that. I once worked with a wonderful individual, super great lady, but she was scared of flying. You know, getting onto an airplane was a really scary thing for her. So we talked about what's the scary part of that? And she's like, well, I'm just worried that the plane is going to crash. That, you know, I'll go where I'm going and plane will crash. And so one of the techniques that we tried is what we called estimating the odds. And so I said to her, okay, well, what do you think are the chances that that plane's going to crash? She thought for a minute and she thought, well, that plane's going to take off and it's either going to land safely or it's going to crash. 50-50. 50-50. Wait a minute. And I was like, if that's true, and this is where she needs to start challenging. If that's true, gosh, that means half of the planes that take off every day would be crashing. How many plane crashes have you heard of today? And she kind of, well, I guess I haven't heard any. So then we started to do a little bit of research. I said, well, we're here in Utah. And I said, well, okay, well, let's look up how many planes fly in and out of Salt Lake International. We looked it up and it was 800. We said, well, if it's a 50-50 odd, that means about 400 of those planes would be crashing every single day. And she said, oh, well, I guess it can't be that. Maybe 50-50 is wrong. Maybe it's 10%. That would be 80 planes crashing a day. Oh, well, it can't be that. Maybe it's just, it's only 1%. And that was still 8 planes a day crashing every day. And so as we were starting to challenge that thinking, and then we were saying, well, how many planes do crash every day? 0. And so then we started to look at, well, how many planes crash around the nation every day? Again, 0. So her odds of going from 50-50 started to get smaller and smaller and smaller. And we actually came to figure out that the odds of this actually happening are probably closer to 1 in about 300 million. And so what she was able to do is then when sitting on the airplane, rather than thinking, oh man, the plane could crash, we actually said, well, let's look at the odds. What are the chances that this is actually going to happen? And she was able to recognize and challenge the thought and say, well, that's not true because we're not hearing about planes crashing every day. And of all the flights that are out there, how many do crash? And so she was able to then say, well, that's probably not accurate. So what is more accurate is that this plane will go and take off and land just fine. One other skill that I want you to look at, which is this what if questions. A lot of kids, when they deal with anxiety, have a lot of what if questions. Well, what if this happens? What if this goes on? What if this? And I once worked with a cute little guy. He was probably about 5 years old, and he had a significant anxiety about his car running out of gas. Now, had he ever run out of gas in his car before? No, he had not, right? But he'd get in the car and he'd ask Mom, Mom, how much gas do we have? And Mom would say, we got about a quarter of a tank, buddy. He'd be like, whew. Is that a lot? Yeah, that's a lot, buddy. We'll be able to make it where we're going. And so if the gas light came on, man, he would really just, he would get really on edge. So we started saying, well, buddy, let's talk about answering this what if question. So what if we did run out of gas? What would you actually do? And he kind of, I don't know what I would do. Well, what are our options? We brainstormed a few options. He was like, well, Mom's got a cell phone. Okay. Would we call somebody? Yeah, we'd call Dad. Okay. What do you think Dad would do? I think he'd probably come bring us some gas. And we kind of joked, like, well, maybe Dad would be like, too bad for you guys are stuck on the side of the road. And he was like, nah, my dad wouldn't do that. Okay. And then we started to ask a lot of the what if questions. What if Dad doesn't answer his phone? Whoa. Then we call Grandma. He started going through all these people that he could call. And then the next question was, what if Mom's phone doesn't work? Whoa. I guess then we'd probably have to walk somewhere. Where would we walk to? Probably a gas station. And then what would you do? We'd get some gas. And then what? We'd put it in our car and we'd get some gas. Every what if situation that we came up with, as he worked through, he himself was able to come up with the answer of what would I do? See, often when we deal with anxiety, there is a significant avoidance component to it. And part of the problem with the avoidance is sometimes we don't want to think about it. Sometimes we avoid the feared stimulus. And so by going through the what if process, it actually caused him to face that, but come to the conclusion each time that no matter what, I would be okay. So those two skills, especially when we work on challenging our thoughts, well, recognizing them and then challenging them, is to be able to look for those inaccuracies, be able to estimate the odds, be able to ask those what if questions. Now, we were talking a little bit about the behavioral aspect. We touched just on facing the fear. For many individuals, anxiety lends itself to a lot of avoidance. Here's a principle about anxiety that I'll let you know, is when we avoid it, it gets worse. When we face it, it gets better. That is true for almost every kind of anxiety that we deal with. When dealing, for example, with OCD, the most common type of treatment for OCD is ERP, or exposure response prevention. Okay? When we work on generalized anxiety, we talk about facing the fear. When we have phobias, we talk about facing the fear. Okay? And so the behavioral aspect that I want you to be considering, because sometimes people will ask me, gosh, Doc, do I get my kid to face this? Do I really push him to do this? The answer is yes. Yes, we do. Give you an example. I have a daughter who, when she was 7, was invited to a birthday party at one of the local pools. It was an outside pool, and so all these 7 and 8-year-old girls are there having a good time. And one of these kiddos has the idea, let's go jump off the diving board. So all these girls line up on the diving board. And what was really interesting is to watch how a couple of kids would respond. There was one kiddo, super good kid, but she got out on that diving board, and I'm here to tell you, when you're on a diving board, it's scary, especially if you've never jumped off one. And you've got two options. Option 1 is jump. Option 2, climb back down. Well, what was interesting is for her, she was out there, I could tell she was scared, and what she did, she climbed back down. After a while, friends are swimming around. Hey, let's go jump off the diving board again. And they encouraged this kiddo, come on, let's go jump off the diving board. She got out there the second time. And I could tell she was nervous then. And what did she do the first time? Well, she climbed back down. And guess what? Humans are creatures of habit. So she climbs back down the second time. Third time, girls are like, come on, let's go jump off the diving board. Come on out here. She gets out there the third time. She didn't stay out there very long, climbed right back down. After about that third time, she wouldn't even jump off the diving board again, or go up on the diving board, excuse me. She just, nope, too scary, wouldn't do it. Now my daughter, she got out there, she hadn't jumped off a tall diving board before, she got out there and she was scared. I could tell she was scared, right? But she made that decision to jump. I can't say that she jumped, she more like stepped off the side, but she went and did it. Hit the water, came down, came up, checked for broken bones, and she was okay. So after a while, the friends are like, hey, let's jump off the diving board again. So there, my daughter got out there the second time. She was still nervous, but not as nervous as the first time. And she jumped off the diving board, made a big splash, came up, and was okay. After a while, the friends are like, let's do it a third time. She gets out there the third time. How's the fear? Less this time. Jumps off. And after about 3 times, these girls started making this line up the diving board, they jump off, swim to the edge, do it again, jump off, started doing little tricks off the diving board, and you could see the fear decrease, okay? So many, many times with kids, we can have something that makes them really nervous, and we want to help them face it. I worked with a little patient once who was really scared of dogs. She had one of those specific phobias, and dogs were the focus of that. And she had some neighbors who would walk to the bus stop every morning and bring their dog with them. And man, she was super nervous. She'd see that dog and she would hightail it out of there. And so the question that mom has was, should I just drive her to school? Should I have her sit in the car? And so we talked about facing it. Okay, what's facing it going to look like? We did some successive approximations where I said, okay, the first thing I just want you to do for the next few days, just don't run. Don't run away from the dog. We've made sure it's a dog on a leash. Yep. It's dog, a friendly dog? The kid was like, I don't think so. Mom was like, it's a pretty friendly dog, pretty safe dog. Okay. I just want you to not run. I just want you to not avoid. And then we said, okay, she got good at that. Dog would show up. She's okay. She'd get on the bus. And then it was like, okay, next thing I want you to do is I want you to get a little closer to the dog. You don't have to go pet it. You don't have to go right beside it. I just want you to get closer. Then after a few times of that, okay, I want you to go stand by it. You don't have to talk to the dog or anything like that. Then I want you to ask the owner about the dog. Then I want you to see if it's okay to pet the dog. All of these successive approximations were designed so that she wouldn't feel like she's afraid of the dog. And by after a few weeks, the dog wasn't an issue anymore. Now, in saying that, the big issue that I want you to be aware of is many times we work on facing the fear. That's the goal that we have, okay? Sometimes the facing the fear isn't something that we can do in vivo, meaning in real life. There's not always a diving board that we can jump off or a dog that we can do. Sometimes, for example, I've had kids that were really afraid of storms, tornadoes. Well, I'm not going to say, hey, move to Kansas and go find a tornado. That's a really bad idea. But sometimes it's facing that in our thoughts, okay? For example, I've worked with lots of kids who have a fear of burglars. Well, we don't want somebody to come break in the house, but we can think about what would happen. How often does this happen? What are the odds? And there are ways to face that rather than to not think about it. Okay, especially true if, let's say, you have a child that has a nightmare and it's really scary. Well, I don't want to talk about it. Actually, the talking about it is what can be really helpful because then again, we are facing it. So the behavioral aspect that I want you to be thinking about is how do I help my child face their fear? Okay, the third thing that we've got is this biological or physiological reaction. With anxiety, when people get anxious, we often see this activation of what we call the sympathetic nervous system. The sympathetic nervous system is what increases our heart rate. It gets our breathing faster. It makes our eyes a little, the pupils dilate a little more. It makes our hearing a little better. It moves blood from our extremities into the large muscle groups. When we have that fight or flight response, man, it's a lot of sympathetic nervous system activation, okay? And so when dealing with that, and many times I'll tell kiddos, that activation of the sympathetic nervous system is not a bad thing. If you're out hiking, for example, with your family and we're going up the mountain, we go around a little bend and there's a bear, are you going to have a physiological response? Yup, you bet you are. I hope so, because that physiological response is designed to keep you alive. But if we're misinterpreting that and thinking that maybe this is something that is dangerous or scary, that's not, then all of a sudden that sympathetic nervous system gets activated. And what we want to do is say, can we bring that response? Can we activate the parasympathetic nervous system? Okay? The parasympathetic nervous system just acts in contrast to the sympathetic nervous system. It just calms everything down. Now, when we talk about heart rate and breathing and pupil dilation and adrenaline being shot into the bloodstream, those are all things that we can't control. But we do have a process that is semi-autonomic. And the semi-autonomic means it's something that we kind of can control. And the place where I go with that is breathing, okay? If we can learn to control our breathing or help our kids to be able to control our breathing, then all of a sudden the skills and tools that we have can actually be utilized. Okay? And so one of the things that I'll often work at with my little patients is we'll talk about something called square breathing. Some people will call it box breathing. You can call it however you like. The reason I like to call it, or the reason I call it square breathing, is I want them to be thinking of a square, okay? 4 equal sides. The idea behind square breathing is breathe in through the nose, hold their breath, breathe out through their mouth, and hold their breath. Now, I'm not saying hold your breath for a long time. I'm just talking about holding it for about as long as it takes you to breathe in. Something that's kind of interesting is that while humans breathe oxygen, actually carbon dioxide is what regulates our cellular breathing. And so when people hyperventilate, you kind of see the funny thing where they'll breathe into a bag. Well, yeah, they're getting too much oxygen. And so when we have an individual that's getting too much oxygen, we hyperventilate. And so what we want to do is actually introduce more carbon dioxide into that system. So if they're getting really nervous and anxious, then that's when we work on our square breathing. Again, breathe in through the nose. Hold it. Out through the mouth. And hold it again. And I'll actually practice this over and over. It's not just a one-time thing like do one box, we're good. But I'll actually have kids practice this a few different times for a couple of minutes. Breathe in, hold, breathe out, hold. The nice thing that I like about square breathing is this is something that can be done anywhere, right? It's something that they can do when they're on the bus. It's something that they can do at night. But as with anything, they've got to practice it, okay? It's sometimes people say, okay, well, that's a great strategy. I'll do that when I'm anxious. Except that I want them to practice it when they're not anxious so that when they are, it's an automatic thing to them, just like dribbling a basketball. Many times when I'm working with my little patients, I'll often tell them, this is stuff that we've got to practice, and like with challenging our thoughts or facing our fear or working on breathing, this is something that we have to do. We can't have somebody else do it for us. It's like exercise. I can't have somebody go and work out for me because I'm too busy today. That's not going to do anything for me. It's actually something that I have to do. So in terms of the skills that I want you to use at home, 3 things that I want you to be considering. 1, let's see if we can recognize and challenge those maladaptive thoughts. It's actually the challenging of those thoughts that is far more beneficial than just helping them to think of other thoughts. In fact, thinking of other things or just thinking of positive thoughts doesn't actually work, okay? It's those negative thoughts that are so detrimental to us that challenging them makes it better. And there's a couple of skills that we talked about, answering those what-if questions, estimating the odds. What are the actual chances of that happening, okay? Those are the cognitive skills to work on. The behavioral skills, like we talked about, facing our fear, right? If we, the diving board story, being able to jump off that diving board even though it's scary. A way to know if we're facing our fear, it's the scarier of the 2 choices. It's a lot scarier to jump off the diving board than it is to climb back down. If we're doing the scarier thing, we're facing our fear. 3rd thing is that breathing aspect. Let's control that physiological response. If we can practice that, get good at regulating our breathing, boy, then we're well on our way to being able to manage those anxiety symptoms, okay? I sure hope that this is helpful for you in working with your kiddos. I firmly believe that your kids are yours for a reason. They're yours so that you can help them with it. And parents that I work with, man, they end up being better therapists and better psychologists for their kids than someone like me will ever be. So use those skills, practice those skills, and then if you're still struggling, obviously reach out to a professional.